My name is Kath Sansom, and I founded Sling the Mesh campaign 8 years ago in 2015. I set it up really on the foundations of anger. I'm going to be honest at what had happened to me. And I'd had a mesh surgery where I hadn't been given fully informed consent on the risks. I didn't know I was having a piece of plastic permanently implanted into me. And when I went back to my implanting surgeon, he very much gaslit me, treated me as a silly woman, and made me feel foolish and did everything possible to try and make me go away. Now, at that time, I was working as a journalist in a regional newspaper group. And I thought to myself, if you're doing that to me, knowing I'm a journalist, how on earth are you treating perhaps older women who haven't got internet access, or basically, how wrong is this that I've been gaslit, I've been harmed, and I'm not being listened to? So I set up the campaign, like I say, based on anger for my own personal situation. And as the campaign has grown from like 20 women in the early days on the support group, grew exponentially to almost 10,000 members now. And in all honesty, that anger still hasn't left me, but I turned my anger into positive action. So that's where I'm coming from in terms of patient safety. There's so many elements of Sling the Mesh that are fulfilling, but there are also so many elements of Sling the Mesh that are devastating and heartbreaking. And over the years, I've had to put in a lot of effort to take care of my own well-being, because it's tough. It's really tough to oversee a large cohort of women and men, because we have men on the page whose lives has been shattered from hernia mesh. But to oversee a group of people whose lives have been irreversibly shattered, some absolutely terribly, and to see this same narrative play out every single day, every week, every month on the page of people joining saying, but I wasn't told any risk, and I was told I was a mystery patient, and I was basically laughed at, or I was told to go and see a psychotherapist, or I was told that actually I'm not very strong and I'm not dealing well with pain, and maybe it's because of a past life experience. And this isn't just one-off narratives. These are the same stories day in, day out of people who trusted their doctor, trusted their surgeon. They've been harmed and they've faced a wall of denial, and it's institutional denial. And that's not just the UK, this is globally. And so seeing that every single day is devastating. Like I say, we have to do a lot of work to keep ourselves emotionally well, I would say. So while it's fulfilling all the achievements of Sling the Mesh, of course, it is tempered by the distress of witnessing so much harm and seeing the fight that we still have to do on a regular basis to have our voices heard. I still don't think that patients are getting fully informed consent in the UK, or indeed globally, to properly understand the risks of what they're taking or what they're having implanted. The risks versus benefit is really important. So, for example, if you have end-stage cancer and you're really, really poorly, and you're offered a drug that could make you considerably better or have a better quality of life, but there are some risks, you take those risks, I'm sure. But for us, for example, with mesh, so I suffered stress incontinence after babies, and actually the benefit of having those life leaks fixed, if you like, versus constant pain, infection, or all the horrendous risks of mesh, the risk versus benefit honestly was not worth it. But that was not communicated to me, or indeed 90% of the group. And that's key, this getting to grips with how can we make sure patients get fully informed consent. So that's #1 challenge. I think secondly is long-term logging. So we saw with the breast implant scandal, obviously the mesh scandal, the metal hip scandal, of patients being harmed, and then how do you track them? On a positive, we now have the hip registry, and that's amazing. And so there's work going on now, thanks to a lot of the campaigning by Sling the Mesh and our submission to the first Do No Harm review. We said there needs to be long-term tracking of patients on registries so that you can spot trends of harm, so that you can investigate trends of harm, so you can, if need be, suspend a particular operation or a treatment if there are trends of harm, because that hasn't been happening. For Mesh, 2 decades of unnecessary harm to women whose lives are irreversibly shattered simply because there was nobody tracking them long term for life. And for anyone watching that doesn't know much about Mesh, I think a key thing is that you might be fine for a few weeks, a few months, or even a few years. And there's that ticking time bomb long-term element where it can harden, it can degrade, it can fragment and turn into almost an internal knife, sorry. But that can take a long time. So unless you're tracking a patient for life with that implant for life, you're not going to know the scale of harm. So the tracking patients is really key as well. And I think a final thing that is frustrating, and certainly in some way this needs looking at, but if you want to elevate your voice within Parliament, you have to go to your local MP. I get that. But if your local MP is really super busy, or if they have a really important role within the cabinet, for example, they're not going to maybe listen to you in a way that they should. So there needs to be some way to bypass this local constituency route, because otherwise there's a lot of people out there who have very valid concerns, but their voices aren't being heard simply because their MP hasn't been able to pick up the challenge and take it into Westminster. And that's crucial as well. There are so many other things that need doing, but they feel like the most important. When it comes to regulation, myself, the Privados campaigners, and I'm sure the Valprut campaigners and many other patient safety campaigners, we bang our heads against a brick wall when we talk about the MHRA. Now, they are supposed to regulate medicines and medical devices, and we have been catastrophically failed by the MHRA. And one of the key things to me is there's something called the yellow card system, which most of the public haven't heard about. And that's where the public can log complications of a medicine, a drug, homeopathic treatments, even vapes, but you can log them. And that's fine. Doctors can also log complications, but it is not mandatory for doctors to log to the yellow card. Now, it seems to me if most of the public haven't heard of the yellow card, and if it's not mandatory for doctors to log complications, there's going to be thousands of complications falling into a black hole. So we don't know just how much harm is going on out there. And we lobbied for it to be mandatory for doctors to log yellow card reports, and that's hitting a brick wall every time. But again, we need to find some kind of system in the name of patient safety where if you go to your healthcare professional, that complaint is logged with the regulator, the MHRA, because if not, again, your story is unheard. I understand that everyone's after miracle cures for all sorts of ailments and diseases. I get that. But you can't just rush innovations to market without having a safety net, because you might as well just park a load of ambulances at the bottom of a cliff and just let people fall in and then let them be whisked off, and you never know really what happens to them. That is what innovation is like without that safety net. So we need to have some way to log harm, spot trends of harm, action trends of harm, because without that, you are going to get another mesh scandal. another Primados scandal, another valproate scandal. So the next big thing that Sling the Mesh is focusing on is the implementation of a Sunshine Payment Style Act for the UK. This was a key part of our campaign right from the start, and we successfully lobbied to have a section put into the Health and Social Care Act of 2022. And that's section 92 that was added in because of all of our hard work campaigning. And basically what that does is lay the foundations for a Sunshine Payment Act for the UK. Now, what that means is industry, so like your giant pharmaceuticals, medical device makers, they would legally have to declare how much money they have paid to doctors, researchers, teaching hospitals. We believe they should also be made to publicly declare how much money they give to healthcare charities, because there's a lot of money going into health charities at the moment, as I'm sure a lot of people will know. So that act would force industry to log all those payments on a public database. Then what will happen, patient safety campaigners like myself can then go on that database and we can have a look and think, hang on, this doctor is promoting mesh all of a sudden. What if they've taken payment from industry? You can type their name in and you can see yes or no, they either have or they haven't. Or a new paper has come out saying mesh is really amazing and it doesn't cause autoimmune diseases. So you can think, hang on, who are the authors of that paper? Type in their names and it will come up. Now that system is available in America and has been for almost 10 years. So if there's an American piece of scientific evidence that comes out, the first thing I do is go to their database and check if the doctors have taken payments. And it's been proven that if a doctor or a researcher takes payment from industry, it will bias them in favor of particular treatments, or it will bias and skew their research. So that's a really key thing that we're working on at the moment. The government said there would be a consultation on the Sunshine Payment Act, Section 92, in the summer, but it's now the summer and we haven't heard anything. So we're going to continue to put pressure on to find out where is that consultation. We will continue to put pressure on to ask people to please comment as stakeholders and push this over the line so we can get a Sunshine Payment Act for the UK like they have in America. Another thing that's happening at the moment is the Patient Safety Commissioner has taken up the challenge of supporting us to urge the government to give women harmed by mesh, Primados and valproate financial redress. She's going to be engaging with patient support groups like myself and getting people's views on what do you want? How do you see financial redress working? How can we set up a scheme? There's also going to be an online survey so that women can get involved from the support group. And at the end of that, a report will be put together and will be sent to government, who will then make a decision. Now, it's been 3 years since the first Do No Harm report was published. And we had a report asking for financial redress. We then had a patient reference group asking for the financial redress. And we've now got this latest report going to government. We hope this is not a way to stall it. We hope it's not a way to kick it into the long grass, because our members need that financial help. They've been impacted physically, emotionally, and financially, and we definitely need that compensation. The one magic wand thing that I would like to see to improve patient safety would be mandatory logging of adverse events by doctors to the yellow card system, because that would scoop up thousands of complications and thousands of people suffering, and we would start to get a proper picture of the landscape of what is going on at the moment and how people are being harmed. And it's not just logging them with the yellow card, it's having somebody at the other end at the MHRA properly looking at the data that comes in so we can spot trends of harm early. And that would be key for me. When I look at how I've come into the patient safety arena, it was only through personal experience. You know, this isn't my job. I do it voluntarily. I spend hours before work, after work, in the middle of the night, at weekends, on my days off. I mean, hours. I mean, people who know me well will know I sometimes send emails at 3 o'clock in the morning, 2 o'clock in the morning, 11 o'clock at night. I mean, it's consumed my life, to be fair. And I work full time doing a different job. But really, my campaign is full time, but juggling in with my job, pro bono. It's not something I ever thought I would get involved in. Why would I? But I think once you've been harmed and then ignored, there's that sense of responsibility that you want to do something to help. There's that sense of anger that I've spoken about before, and there's that sense of social justice, that this is the right thing to do. However, what a lot of people don't see is the personal impact it has taken on me, the emotional toll, the exhaustion, the tears. Sometimes my girls, they're now in their 20s, my daughters, but they'll sometimes just tell me off and go, "Mum, stop meshing, take a break," you know? That's the side that I think people just don't see. And that's not just me, that will go for all patient safety campaigners, because you become so passionate about what you're doing, and so dedicated and determined to help others, that sometimes you forget to look after yourself. And I would say that's been a really big lesson for me, to make sure I just take time out. But it's really hard, because you're so motivated to do the right thing, and really it's like a giant snowplow coming at you constantly of things that need doing. So that's another difficulty in itself, just taking that time for self-care.